Hey everybody, my name is Mike Calvin, and I am the course coordinator for NU361. Ms. Puckett will be the co-coordinator. If you have any questions about anything in NU361, call me, okay? Not her, so call the coordinator. If I'm out of town or whatever, I will send you a message, and you're going to check your messages daily, so you'll know that I am, and I will instruct you to call Ms. Puckett at that time. So always start with the coordinator. My cell phone and my office phone is posted in the RN to BSN resource page, so it's there. Okay, NU361 is a bit different because it's your clinical course. Every semester you have one clinical course, and this is it. Okay, clinical is a little bit different. Let's go ahead and open up the modules. Okay, everything again here is in modules. As you go down, we're going to talk about Shadow Health in just a moment. Shadow Health is an online interactive physical assessment tool where you actually interact with an avatar that will answer your questions. You can actually talk to it this semester instead of having to talk. It recognizes your questions and will respond back to you. So you perform assessments based on this. All of your Shadow Health information is down through here. Okay? The introduction videos, I'm going to show you a short video today that's about 4 minutes long. Okay? It gives you a very quick 4-minute overview of what Shadow Health is. These videos go more into detail. You definitely want to watch them. Okay? So definitely on that. This is broken up into 3 units. Unit 1, which is basically your introductory stuff. Unit 2, which is all of your single system assessments, the neuro assessment, musculoskeletal, etc. In that, there are quizzes. You see that you have got Unit 2 quiz, 2B quiz, and 2C quiz. Quizzes. All of the policy applies that we've already talked about. Quizzes cannot be made up. If you know something is going to be going on, call me and we can talk about an extension, okay? That will be the only way, an extension will be the only way that you can turn a quiz in after the due date. And I don't give extensions after the fact unless it's something like you were in a bad car wreck and you just couldn't call me. That's a whole different ballgame. I don't give extensions for I'm working 3 straight days during that time. You know that ahead of time, okay? So if you've got a deal, call me and we'll talk about an extension. All of the other things are assignment type things. You can turn them in after the due date, but it's going to be 10% per day that you're late. Everything, like every course, is due at 3 p.m. You click on the course calendar up there and you will see everything that's due. Typically my assignments are due on Wednesdays, okay? But make sure you know the dates. I'm telling you this, and there will be at least probably 5 of you out of this thing that will miss that very first quiz and will get a 0, okay? So get this calendar down however you like. If you want to put it in your phone, if you want to print it out and put it on your mirror, know when these assignments are. All of these assignments are open as of now, okay? Quizzes are not. They will be open probably tomorrow afternoon after the other orientation. Quizzes, you get 1 shot at, okay? So if you open it up, you've got 3 hours to take it, but you got to take it right then, okay? You can't go in and out of those. Okay, the quizzes are multiple choice and some short answer, essay type things. And when I say essay, I don't mean page after page after page, but short answer type things. On the short answer, pay attention to what it says. If it says list and describe, list and describe. Don't just list, okay? If it's a 10-point short essay question compared to a 5-point, probably need to go into a lot more detail on the 10-point. So pay attention to things like that, okay? Now, if we'll open up go up to the course, under course information, this is where you have your course overview. Course overview is your syllabus, okay? Okay, it tells things here like course description, books that you're going to need, course outcomes. You're going to read over all of that. It gives you a description of each assignment, evaluation, and then the assignments are here. On the left, you've got it broken down into Unit 1, Unit 2, Unit 1 and Unit 2, and your assignments there. This is a points course. It's 500 points. Okay? You see there in the middle under course points what each thing is worth. You see that there are some things that are worth 0 points. Okay? Those are typically going to be things like under the Unit 1, that Shadow Health Digital Clinical Experience. That's your orientation to Shadow Health. Okay? 0 points, but you've got to do it in order to know how to use it. Okay? And this is in addition to those videos that I talked about under the modules. You see the Conversation Concept Lab. That's where you learn how to talk to these patients. Okay? And then you see your introduction to the health history and the points that are associated with that. And then as you go on down, some of the systems, such as respiratory and abdominal and cardiovascular, you will notice that they have a concept lab with them. That's because those assignments, those assessments are a little bit more in detail, and it goes over an extra lab with you to help you prepare for that. So you're going to hear sounds, you're going to hear different heart sounds, different breath sounds, etc. Okay, so it's a little bit extra with that. Okay, again, you can get into these assignments, you can go in and out of. Okay, so if you know that you're going out of town, way up into November, you can work ahead and you can take care of those assignments theoretically now. Okay, you can go in and out of those. Also in Shadow Health, on these single system assessments, it gives you feedback. Okay, you can go in and out of that. You can complete one and look at the feedback that Shadow Health gives you, and it's going to tell you, you did great in this area, you didn't do very well in this area. You can go back in and you can redo that assignment based on Shadow Health's, the feedback that it gives you. Okay, so hear what I'm telling you? There's no reason not to make an A on every one of these assignments. Now, at the due date, it stops. Okay, so you can do that up until the point of due date. Okay, so look at the feedback that it gives you. There's no reason not to get a great score on that. Okay, we talked about 10% per day. 10% per day after the third day. I know that's only 30%, but after the third day, it's gotten sort of silly at that point. After the third day, it's a 0. Okay, so you got 3 days. All right, now on the right, this is your clinical stuff. Clinical is a little bit different. Clinical does not go towards your final grade. So your final grade of an A, B, C, D does not go towards that. That being said, it's held actually to a bit higher standard. You have to make an overall 85% or better average on clinical things in order to progress. Okay? So it doesn't go towards your grade, but you got to make overall 85% or better. The health assessment checkoff, that's where you're going to do a head-to-toe physical assessment and record that or come up here and do it live. You have to make 85 or greater on that. It's not an average. Okay? If the first time you don't make 85%, you have to redo it, and you get one chance to redo it. And we ask that you come to class or come to campus to do that redo. So that being said, I'm going to show you why you're not going to make less than 85% on it the first time. Because we tell you exactly what you need. So any questions on that? Clinical does not go towards your grade. All of that's on the left. But you got to make 85% average or better. 2 clinical things, the health assessment checkoff and the Shadow Health focused exam. Okay? Notice according to what group you're in is which focused exam you're going to do. TE1, TE2 does cough, and that's the only thing you'll have access to. So hadn't got to worry about that too heavy. That part of Shadow Health, the focused exam, you cannot go in and out of. Okay? You get your shot at that one. But it's the very last thing that you do, so you should have down what we expect by that time and get a good grade on that. Okay, so if you scroll on down, here's the points. We've said that you know, it's a point system, so 460 above is a A, and you see the rest of it. Got to have at least 370 to make that C. Okay? Don't look at the percentage in Canvas. Okay? We go by points, not percentage. Okay? So add your points up. The rest of this, as you go down through there, you're going to read over. You're finally going to get to the conceptual outline here. This is where it tells you where to read. Okay? So you've got your assignments over on the left and required activities. It tells you what chapters to read. Okay? So this is your syllabus that tells you what chapters you read for what assignment. So look at that. Okay? Any questions on that? Okay? Quizzes versus assignments, and then required coursework versus clinical. All right? This is your only clinical course for this semester. You'll have one every semester. It's going to be the same, 85% or greater. Okay? A lot of stuff in here about shadow health, how to work your way through that. Under the physical assessment module, we have got videos on how to complete a head-to-toe physical assessment. You see the 6 right there, okay? Let's talk about the physical assessment. Scroll on down under physical assessment, and you have got the physical assessment content module, as well as a preparing for a successful physical assessment PowerPoint. These things walk you through step by step exactly what we expect for this. Okay? This is going to be a head-to-toe physical assessment on an adult-sized patient. Okay? You pick your patient. It can be your classmate, your mom, your dad, your son, your brother, your neighbor, whoever. Okay? But it has to be an adult size. That being said, you've got 10-year-olds, which are adult size, so a 10-year-old, as long as they're an adult size, you're good to go. It just can't be a pediatric patient. You've got 2 options. Number 1, you can complete this at somewhere outside of here. Okay, it needs to be a clinical type setting. If you've got access to an empty hospital bed, a bay in the ER, in a clinic somewhere like that, that's awesome. I mean, because that you've got a bed, it's truly a clinical setting. If you don't, you can do it out of your home. You just need to sort of make it look as clinical as possible. So on a bed, on a sofa, I've had them where they've draped a table, they're laying on a table, whatever. Okay, but it has to be a clinical type setting. You have to be professionally dressed. So you can have scrubs on, your name tag. You can have professional dress with a lab coat, your name tag. Okay, but you got to be professional dresses. It should be common sense. Though it's amazing how many times I've seen people doing this physical assessment, and you know, the person videoing it, you know, you see that they're nice and got scrubs on, and then they scroll down somewhere and the person's barefooted. Okay? Had that happen on numerous occasions. So professional dress. Yeah, we've had dogs that walk through, and that's okay. Just, you know, just try to make it as professional as possible. Okay, 2 shots. You can do it at home and record it, or you can choose to come do it live, and I'll put out instructions for that. If you record it, you're going to download it to YouTube and send us that YouTube link. I have YouTube instructions here. If you've never used YouTube, that's okay. You have an MUW email, that's a Google account. That will give you an account to YouTube. Okay? A Google account is what you need to get into YouTube. If you already have a YouTube account, you can use that. If your nephew is on YouTube all the time, he knows how to do it. I don't care if you use his account. You just got to get me a YouTube link that works. Okay? And as it gets closer, I'll give you specific instructions about that. But these videos, they're not long. They're 5 minutes apiece. Walks you through step by step how to create an account, how to download it from an iPhone, from an Android. It goes through it. Okay? The other option is come do it live. Okay? And that's really, in my opinion, a great option. Because I find if you video it, it takes, you redo it and redo it and redo it, and you end up spending 6 hours on a 20-minute project. You come up here, do it live, you do it in 20 minutes and walk out the door. Okay? your choice. All right, let's go up to the assignments and open up the physical assessment checkoff form. Open it up there. This is the form that you're going to use. Okay. The first part is a history. You're going to do that obviously beforehand. You're going to fill all of that out. If you come do it live, that needs to be filled out before you get here. I don't want to see this on video, so you don't have to do that. Fill it out and then do your assessment. Scroll on down. I wonder how to make that where it's not 2 pages. Okay. Okay, this is the checkoff form. You're going to fill that top out, and then you're going to complete your assessment based on this. Okay? It tells you exactly what to do. If the person is completely normal, you're not going to have anything to put. Any abnormal findings, you will document, you see there. Okay? So this tells you exactly what we want. Go by this checklist. Do it in this order. We have it in a logical order. Okay? So in other words, don't start with the head and then go down to the feet and then up to the, the cardiovascular. Go by this. Okay? Only do what's on here. That's all you got to do. If you want to do extra, you can, but we're not going to grade it. Okay? When you watch those videos, it's going to go over stuff a lot more than this. Okay? Ignore that part. Learn how to do on the videos out of your book, how to do this stuff, and do this. Okay? It's okay if you make note cards. Okay? I just don't want to see you reading just off the note cards. I don't care if I see the note cards in the video. That's okay. You just can't just read off of them. Use them as a hint. We talk about that in the video. Okay? So you've got all kinds of tools to get this thing done. Additionally, sometime in this semester, and I'll put out a date, you can come here and I will do a live physical assessment on a patient, and you can come and watch. You can ask questions, you can do whatever. It's not mandatory at all. If somebody that, some of you live down in Biloxi, you're probably not going to want to drive 6 hours for that. Okay, but I will do that, and I will use this form to do it, and you guys can ask questions. So I will post things about that. Check your announcements and stuff on pretty often in this course, because if things are going on, things that I'm getting a lot of calls about, I'll make a video to address that situation, and I will post that in Canvas. Okay? Call me if you have issues. Okay. Any questions on the physical assessment? Now, there's nothing in there that requires you to expose someone. So we're not doing breast assessments. We're not doing anything like that. If you use a female client, that's perfectly fine. I do need to see what you're assessing. So when you tell me that you're assessing the skin of the back, if they've got a t-shirt on, you can't do that, because you're not, okay? So this physical assessment is not you acting like you're doing a physical assessment. It is you doing a physical assessment that you film, okay? So for a lady, you can do a tank top, something that can be pulled up. Sports bras work great. I mean, they're not exposing anything. They give full coverage, yet you can still see. Basically, you need to be able to see from here up and from here down and then on the back. For a guy, obviously that doesn't come into play. So shorts on a guy, with a girl, shorts, whatever. Okay, any questions about that? And again, as it gets closer, I'm going to make a video that I will go over more detail about that than today.
I have a question.
Sure.
You only need shadow help if you're in 361, correct?
Yes.
Okay.
So if you're not in 361, then there may be somebody with a spec that's not in it that I don't know why they're not, but I'm assuming most all of y'all are. You have to have shadow help. You can't share an access code with your roommate because it grades your shadow health. Okay? Any questions? So we're going to look at a short, like 4-minute video on shadow health. And bear with us on shadow health. This is we've taught using shadow health one time this summer. That class had 9 people in it. Okay? So this is still something that is new to us. There's about, I don't know the final number, there's about 380 of you guys. So a class with 380 is obviously a completely different deal than a class with 9. So we're going to learn with the shadow health as well. If you have issues, let me know. How do we make sound?